All right, a warm welcome again to Good Morning Kenya. This is KBC. We appreciate your presence each and every morning. And today being a Tuesday, you know, when it comes to Tuesday, we always talk about matters health. This morning, we'll be talking about one of the big four agenda, UHC, Universal Health Coverage. But one thing that I got from, feedback that I got online, someone was asking me, what is UHC? What is Universal Health Coverage? And I was going through some study that was sent out by the Nationwide Perception Study on UHC. It says that around 31% of Kenyans actually are aware of UHC. Most people don't know what Universal Health Coverage is. Well, this morning we shall be talking about universal health coverage, but not only that, our angle also shall be on the private sector and how the private sector can be a key player in achieving one of these big four agenda, that is the universal health coverage. This morning I'm joined by, next to me, George Muli Mudheka, director of Oloibon Medical Center. Karibu sana, George.
Thank you.
And to my extreme left, I'm joined by Rita Mwachandi, Senior Business Manager at the Population Service Kenya. Karibu sana, Rita.
Thank you for having me.
And it's a pleasure having the both of you as we talk about UHC. And ninaomba mdomo changu isinisumbue hapo. Niseme kitu tofauti na UHC. Well, you can be part of this conversation. The SMS line is 20154. That is the number. Start with what channel you want, tell us your name and where you're watching us from. Send us your questions, your comments, and your thoughts with regards to universal health coverage. The Twitter handle is also on at KBC Television. Tag me at Ram Aguko. My colleague's handle at Jane Wamboy. The official station handle is KBC Television. First things first, I was talking about UHC and I was wondering, whether people understand what it's all about. But let's start from just the basic definition first, because we are yet to have a lot of discussion with regards to this. But for the common mananchi, for the benefit of the viewer, what is UHC? Rita.
So thank you for having me, first of all. So I think from a very basic perspective, let us define UHC as the ability for the government or for citizens to receive health care, decent health care, without financial hardship. I think it's been said that a lot of us are only a terminal illness away from poverty. So the best way to define UHC is to ensure that everyone can be able to access decent health care, affordable, quality health care, without financial difficulty.
All right. Do you have anything to add on that in terms of what UHC is all about?
I think UHC is all about all of us being involved, because the government cannot provide that service without us as providers, and also the population, because the uptake of UHC is important for it to be successful. Yes.
All right. And I would like us to just get into the nitty-gritties now of what it's all about. We have the private sector that is very key in achieving this. UHC, one of the big four agenda, but now how far are we in achieving universal health coverage? And as you can tell us also, how is the private sector also playing a key role in implementing this? How is it an important component of health service delivery? Rita.
So let me begin by saying that as a country we have made great milestones in terms of edging closer to our aspirations toward UHC. We have a lot of policy and national blueprints that are guiding us on how to achieve UHC as a country. I think the best known to Kenyans right now is the Big Four agenda. And the government has been very keen on ensuring that we meet the milestones that they have set. So we've seen within universal health coverage, the government rolling out free maternity services, which has ensured that women can be able to access a hospital birth. As we speak, since the free maternity service was launched in 2013, facility delivery has increased by 29% from what it used to be prior to that. And that number is increasing day by day. And I think also a fantastic statistic is that we are seeing the decline in the ratio of neonatal mortalities. So I think that's a big step for this country. The other thing about UHC is that I think we are also well aware that the government rolled out the UHC pilot in four pilot counties. That's Nyeri, Kisumu, Isiolo, and Machakos. So again, that is going to be very instrumental. It's run for a year. So right now they are synthesizing the experiences and the data that they have gotten from that. And so that is also going to be very instrumental in ensuring that we also continue to learn and to roll out UHC to the other 43 counties. So we've made great milestones. What we are saying is that rolling out UHC or achieving UHC for this country cannot be just the work of the government or the public sector. We want to see that all players, all stakeholders within UHC are involved, and that's why we are calling for the private sector to also come on board and be involved in this this agenda of UHC. And why do I say so? I say so because 52% of health facilities in this country are owned by the private sector.
And funny enough is that half of all outpatient services are given by the private sector.
At the private sector.
Absolutely, yeah. And I think it's interesting when we talk about private sector, I think a lot of people, what they have in mind is the high-end private facilities, and most of them are located in urban centers. But when you say private facilities, we're even talking about the community facilities that we have in our neighborhoods that provide these essential services, outpatient services to customers. And these are the facilities that see the bulk of the patients in this country. Actually, 47% of people in the two lowest health quintiles access healthcare services, their outpatient services, through the private sector. So you can see it's not private sector high end, it's private sector ordinary that the ordinary mwananchi visits day by day.
And coming to you, George, what is the role of the private sector in achieving the Big Four agenda?
The biggest role of the private sector, which we are part of, is to complement the efforts that the government is making towards providing health services to this nation. And key to what my colleague has said, the entry point to care. The entry point to care most of the time is from the community level and the primary clinics that we have within our neighborhoods. And if anything goes wrong, it has to start from the entry point of care, either misdiagnosis and all that. And being a key component, one of the successes of UHC will be to involve everyone who is serving a Kenyan, be it the private, be it the public, in terms of ensuring that there is a level playing field when it comes to offering services in UHC.
From both public and private sector.
Both public and private sector.
But I'm wondering, why is it that the reach to the Kenyans is low? How can we increase the observance rate of UHC to the common mwananchi, to the Wanjiko on the ground? Because looking at the percentage that was sent out by research according to nationwide perception index, they say most Kenyans don't understand what UHC is all about. How can we change this narrative?
So I think first is just understanding what is the definition of UHC, and then secondly is about access. So when I say access, I mean, do people have the ability to pay? And the reality is that not everyone will always have the ability to pay. And that's where there is a place for subsidy and for people to access health services without going back into their pockets for them to pay for that health care. And that's where the role of the government is very important in ensuring that people can go to a public facility and access that care. But there is another cadre of people, like probably me and you, who can be able to pay for something small and visit a private health facility. And this is just to ensure that the entire health system is working together in unison, because the public sector will be overburdened if everyone is going to go to the public sector. So what we are saying is that if through mechanisms such as the NHIF, if we can be able to have Kenyans who can be able to pay for something small, to pay for their healthcare services through NHIF and access services through private facilities such as the one that George runs, then we are going to start increasing the coverage of UHC. And then again, also looking at the kind of the spectra of services covered. So right now we are saying maternity services are free. But maternity service is just one aspect of the services that a woman would be able to, would want to access. And probably it also covers immunization, and immunization is also just part of the services that a woman would want for her child. What happens to the other scope of services that this woman and her family are going to consume? So when we say we want more people to be covered by universal health coverage, we want to see the basket of services that they can be able to access, either paying through a third party, so being insurance, and NHIF is right now the best that we have in terms of affordability. So either through an insurance or through accessing those services in government facilities. So increasing the basket of services that are being offered, but also ensuring that people are not paying these services through their pockets. So there's some sort of like a financial protection for them.
Right. What are the failures that we've experienced so far? Because so far, based on the numbers, there is a loophole that needs to be sealed. There is a gap that needs to be filled. How can we bridge this gap?
I think we need to look at it in the approach way. The approach in terms of access. Not all Kenyans are wealthy. Not all Kenyans are poor. And again, we're only looking at NHIF as the only insurance provider for the UHC. I'm looking at it in form of involving also the private insurance companies to come up with products that can still fit those particular individuals.
Okay. Not just the NHIF.
Not just the NHIF, because the NHIF is just one part of it. But it is not the only player when it comes to medical insurance. So I think the government and the private insurance should also come up with innovative programs that can be able to accelerate the access to universal health care to this population, because they have a duty, they have a responsibility. And a healthy nation, of course, is a developing nation. It's one of the key indicators for growth of any nation.
All right.
Yes.
So speaking of that, we are talking about the private sector playing a role there. But is it well absorbed in the private sector, universal health coverage?
So let me start by saying that over the years, government has rolled out quite a bit, but we are seeing a lot of these interventions going through the public sector, and naturally because that's an area that the government understands pretty well. But we are saying that Kenya has a mixed health system, so we cannot ignore the role that the private sector is playing in this country. And what we are asking for is how can the private sector be brought on board. We have not seen that happening as fast as we would like it to happen. And I'll give you an example of the free maternity services. So when those were first rolled out, they were first rolled out in the public sector. And then 5 years later, that's when we saw the private sector being brought in to be able to provide services. So why are we saying that it's important for the private sector to be involved? We need to increase access. We need to increase the footprint of facilities that customers can be able to access healthcare from. So there are some places that you will go and you may not find a public facility. Where do those people terminate to be able to access healthcare?
But at the same time, I'm looking at the case where we talk about access.
Yes.
Is it being received in the first place?
So
because you're talking about access, are we reaching out to the private sector so that they can also reach back?
So there's been efforts to reach out to the private sector, but I think from where I stand, I feel that those efforts have not been adequate. There's still more that can be done. Like, for example, I'm not very clear why the private sector has not been involved in the UHC pilot. And I know that probably what I'll be told, it's a pilot, and the aim was to be able to see what models work. But how can we ensure that such models can also be tested in the private sector, such that by the time we roll out to the other 43 counties, then it's everyone who's being a part of providing services and increasing access to the poor. Let me talk about equity. I think George touched on equity.
Yeah.
So with access also goes equity, because you can have enough health facilities countrywide where people can be able to access healthcare, but can they be able, those who cannot be able to afford, can they be able to access those services? And that's why health insurance becomes very important. So I agree with George that there is a place for private insurers, but in terms of access, this is where the role of the government is very critical in ensuring that those people without ability to pay either can be able to access these services at a very subsidized rate at public facilities, but also to decongest the public facilities. How can we be able to put a payment mechanism that this poor person can be able to go to George's facility, to a private facility, and pay for that care? And that's why we are saying the private sector needs to be involved, because if you have a Linda Mama cover or a Linda Mama card, then you can walk into a private facility as a poor person and access services. If you have a government UHC card, then you will not just be able to visit the public sector. You can be able to visit the private sector as well and enjoy these services.
And is it possible for you to enjoy these services regardless of where you're receiving them from, whether it's from the public sector or the private sector, so that we get still yet the same amount of quality services, yet bearing in mind that it is still the quantity is also being balanced, quality versus quantity?
Yes. To start with, we are all licensed and regulated by the Ministry of Health, whether you're a public facility or a private facility. So quality stands the same. So the access is where it differs in terms of the services that are being provided. But to point out, for the success of UHC, we cannot have a blanket and say we're going to provide all the services. It is not tenable, it is not sustainable. The most important thing would be the entry point of the primary health care, and the key indicators like maternity, especially to reduce the infant and maternal mortality rate, and then the preventive services. And then from there, it can be scaled up easily based on the lessons that you've learned from the beginning. And again, when you are running the UHC pilot, if it is going to be scaled up, the challenges that are being faced by the private sector are not yet known, because it was not part of the pilot that was being done. So while scaling it up, it may work mostly for the public health sector, and still face some challenges in the private sector. So at this point, I would still say that it's important for the stakeholders to involve all of us, the private and the public sector, in terms of equitable access to care for all Kenyans. And mostly fairness. When it comes to fairness, it means that that person who has had an accident may not have time to reach the nearest referral center. So that person will pop in my facility. We have to do emergency treatment before that person is referred.
And I'm also looking at the mothers, the grandmothers, so that they can also be able to get the quality services, whether they go to the public or the private, because sometimes there are normally public outcries with regards to where you get services, so they tend to go to some private facilities and feeling as though that if I would go to this facility, I may not get as much as I wanted as compared to if I went to this other facility. How can we bridge that gap in a way that we can make all Kenyans feel free enough to go to any facility at any time, at any given situation, and be able to get the same universal health coverage?
So I think the element of health system strengthening is very key. And what this does is that we first of all need to ensure that there's quality of care across board. So whether you visit a public facility or you visit a private facility, then you as a customer are guaranteed that you're getting the same quality of care. And this begins at the policy level. So what guidelines or what standards are we using as a country to be able to define what is quality healthcare? And then how are we continuously supporting the health workforce to improve on quality on an ongoing basis? So what we've done, so in the public sector, I think by and large the system works. So there's a governing body through the Ministry of Health that offers continuous supportive supervision to the public sector, training to ensure that public facilities, health workers working in the public facilities are improving on quality on an ongoing basis and their skills. But there's been a gap in the private sector. And the gap in the private sector is that there has not been, though George says that they are regulated by the government of Kenya, supportive supervision is not as regular as we would want it to happen. Also, trainings are not as regular as they would like them to happen. And
doesn't that even affect the services?
It does. We know that medicine is a very dynamic industry, so things are changing. Things are changing pretty fast. So how do we ensure that these providers are getting updates as they should? So what we've done as a private sector is to begin to organize ourselves in groups where we can be able to provide this level of support to health providers. And one such case is social franchising. So social franchising brings together private health providers and supports them in terms of training, supports them in terms of quality assurance, in terms of business support, in terms of expanding the scope of services that they offer, just to ensure that they are able to provide care and of a certain quality to anyone that walks into a facility.
And I love what you're saying there. Let's look at community participation. How can we increase that? Coming in, boosting, having a boost from the private sector, getting to engage the community in terms of universal health coverage.
What we have done is, and I give credit to PS Kenya for having enrolled us into the Tunza franchise. When we started as private sector, we didn't have that proper link within the community to the facility. And when we joined Tunza as a franchise, there was so much skill empowerment and management empowerment, and we've been able to have a lot of demand creation activities which involve linking up the services within the community and the facility. And as at today, I think one of the greatest links and successes of the Tunza facilities is a linkage to the community health mobilizers or health workers, because they give us a direct link to the community, and we're able to reach information to and from the facility. Any update that has come, anything that we want to do within the community, or any particular health challenge that has arisen, it becomes easier to reach through the community health workers.
And at this point, because now we're talking about the community,
yes,
I think this is a good point to bring in what PS Kenya, because you mentioned PS Kenya.
Yes.
What is it all about? Population, Population Service Kenya. What is PS Kenya all about? And you'll also talk about Tunza.
Yes.
So Population Services Kenya is an NGO working in the public health space. And what we do is to support the government of Kenya to be able to roll out their public health initiatives. So we have programs in malaria, in reproductive health, in HIV, in cervical cancer, and also in NCDs. And what we strive to do is to be able to empower Kenyans to make healthy decisions and to take charge of their health. I think even also where universal health coverage is going right now is in promotive and preventative health, not just curative. So catching people before they get sick and making people take charge of that health and ensure that they are preserving their well-being.
Then how do you involve the community now as you talk about PS Kenya in your mandate?
So PS Kenya delivers its mandates using 3 core pillars. One is that we social market health products. Secondly is that we use social behavior change, and that's what George is talking about, where we go into the communities and we teach them about various aspects of health on certain health areas. And then thirdly, we do it through social franchising, which is what we are calling health system strengthening. So under social franchising, what we do is that we support a group of 415 health facilities to grow their facilities, and also to ensure that the facility is running well in terms of quality, in terms of business growth, but also in terms of engaging the community. As PS Kenya, we have been running the Tunza franchise for the last 10 years.
10 years.
Yeah, 10 years. And what we do is we have regular engagements with providers to do training. And then we go into these facilities to do what we call facilitative supportive supervision, which means the skills that we, the knowledge and skills that we transferred in the classroom, we go to the facilities to ensure that those skills are being institutionalized and quality of care is being provided within the set guidelines. Let me say that PS Kenya does not operate in isolation. All our trainings and all our quality assurance frameworks are those of the government. So it's just really helping the government to roll out its tools and its products within the private sector.
All right. Oh, thank you. No, Tunza Kenya, what is it all about?
Tunza is a franchise of PS Kenya, and as Rita has said, it has 415 facilities, of which I am one of them. And I'm one of the greatest beneficiaries of the Tunza franchise.
How long have you been there?
I joined in 2014.
Wow.
And I think since that time I joined, I've seen so much benefit, both for my customers and also for my for my staff and for the organization as a whole.
So it means that it's getting to the people on the ground.
It is getting to the people on the ground. And to say that, it means that one of the key things that PS Kenya has done and in the Tunza franchise is to organize for those trainings to empower us with skills, and they continuously follow us up and ensure that what has been trained has been transferred to the staff, they have been strengthened, and they have become competent, so that the quality improves. And we have seen quite an improved number of visits within the facility, and increased customer satisfaction. And the other thing is also increased revenues.
All right.
Yeah.
Now, speaking of revenue, you had alluded, the both of you had alluded to this earlier on, financial capacity that has been given out, especially from the side of the Kenyans, towards paying for health services. I am aware that we have about 25% of people who are Kenyans are either under civil servants or formal employment insurance schemes, and meaning that the rest of the Kenyans normally pay directly to access health services. How does UHC help in terms of the financial capacity of the Kenyan, helping them to be able to reduce on the expenses, yet get the same quality of services in the health facilities?
So you'll recall when we defined universal health coverage, one of the things that we said is that it should aim at reducing financial strain on the part of the customer.
Yes.
And the way that it reduces financial strain is to ensure that the customer is not paying out of pocket. I think when you're paying for small outpatient is probably attainable, but not everyone has that money to pay for that outpatient. So what we are saying is, how can we see everybody have a payment mechanism in their hands that empowers them to walk into a facility to seek care. We shouldn't be having people choosing between having a meal and going to hospital. People should know that, as long as I have, a card with me or a payment mechanism with me, I can walk to the health facility and be able to pay for those services. So what we are saying is, as we think about UHC, we should, in tandem think about payment mechanisms. And we have mentioned some. So the free maternity service is one where the government is paying on behalf of Kenyans. There's the NHIF that George spoke about. The NHIF is people either who are being paid for by their employers, or there's a lower cover, what we call it the super cover, where people are paying for themselves.
And I love that, because most Kenyans, or some, may not know that actually there are some services that are given for free.
Yes.
By government.
Yes.
You said one of them is
the free maternity service.
Yeah, so make sure that you are aware about this. There's free maternity services that is given from the government, that you can be able to get your health services from whichever place that you are, as long as you're within the country.
Both public and private, as long as you're registered for UHC. All you need to do is register, and you can be able to access those services. The second is where you put a payment mechanism in the hands of the consumer to empower them to seek services. Is I was talking about NHIF, and NHIF has got various schemes. And one of the schemes that I think that is very core and we need to talk about is what they call the super cover scheme. The super cover scheme goes for 6,000 shillings a year.
500 a month.
500 a month, yeah, 500 a month. So again, is just ensuring that you can pay little by little, just to ensure that when you really need healthcare, then you're not going into catastrophic spending, where you're being impoverished by spends because you didn't think about that, how you'd be able to access care if disease hits you. So that's a payment mechanism that is being put in the hands of the consumer. Then there's what the government is trying to do with UHC. So George was saying it's not possible to offer all services for free, but what is the essential package that Kenyans can be able to get access to, even as they pay for for higher level service through mechanisms like NHIF. So that's what is being piloted by the UHC. And once we get what the results were from these 4 pilot counties, that is what the government that will essentially roll out nationally to ensure that at least for certain essential services, such as malaria, diarrhea, immunization, at least the population is covered for those. And I think it's a journey. I think it's not an overnight wonder. We will continue to achieve it in milestones. We are getting there. We are getting there. Yeah, we are
achievable.
It is achievable.
It is achievable. I wanted to add on something.
Yes.
The government cannot achieve UHC alone.
What does the government need to achieve it?
You and me, we need to change our attitudes, because I think our population have attitudes which needs to be changed. We are aware of NHIF. When you get someone sick, that is the time you are seeking for the NHIF. Does it work at that point in time? So we need to be serious. We need to change our attitudes towards the way we seek care. We need to take charge of our own health. There are people who are working. There are people who are their own bosses, but they don't pay for NHIF. There are people who are getting small amounts of money every day, and they are aware of NHIF. And yet, they are the ones who are going to say, nichangie,
When we get sick, is
when you get sick, that's
where is my NHIF card?
Where is my NHIF card? Or probably you've already taken the NHIF card, and you only paid it the first time. You haven't paid it again. So how do you access these services? So I think we as citizens, we need to own up and change our attitudes and say the government cannot achieve this on its own. We have to be players in it, and willing players.
Don't you think it's because Kenyans don't know about some of these things? Some even get conned when it comes to getting these services. Some don't know about maternity. They get conned and pay so much amount of money just to get basic services that you will have gotten for free.
So that's true, but I think that's why we are saying that programs such as the one that PS Kenya runs are very important, because there's a lot of community engagement. And what we've done as PS Kenya, I think it's also good to mention that we have partnered extensively with NHIF. One, to create awareness about their program, the Super Cover program, but also to go to the grassroots, to the community level, and begin to engage with customers through the community health worker, educating people on why it is important for you to have health insurance. So I think, like George is saying, the biggest problem we have with health insurance is, one is people think that it's expensive. It's very expensive. Secondly, people believe it's for employed people. And then thirdly, people believe that this is something that you get on a need-to basis. If I'm sick, then I can quickly go and renew my NHIF cover. If I'm fine, then I don't need to put in that money. Forgetting that, at the point where you really need it, then you go either into catastrophic spending or you start calling for chamas, as George was saying. So really, I think awareness is high. A study that was done 3 or 4 years ago mentioned that NHIF awareness is at 98%. So people know that there's a mechanism where they can be able to pay for health. So I think it's just translating that awareness into action and just telling people, empowering people to understand why it is important for them to get a cover.
But let me come to you, George. Actually, the both of you, when it comes to payment and financial capacity, someone may wonder, and I would like you to maybe tell us, have you had cases of, or seen cases of people who have gone through deep down their pocket to pay for something that they should have gotten at a cheaper price or even for free? Have you seen that happen?
It does happen. It does happen in most facilities. And I think it is not fair to the Kenyan. Especially where you have to pay excessively for something that when you look at the cost, it's a little bit low. So I don't say that there needs to be regulation, but what needs to be there is that the consumers of healthcare need to be aware of the standard charges for most of the services that are offered within the public and the private sector. I think the awareness of what is being offered, how it is being offered, how much they're supposed to pay on average, gives them a guide. So I believe so much sensitization is still needed to the Kenyan population with regards to the health service provision.
So wherever you are at home, don't think you cannot be conned. Watapeli wako. Unaweza lipa pesa mingi kwa huduma ambao unaweza pata kwa
bei rahisi.
Yes. Ama tabure.
Atabure.
You've seen the same cases, yeah?
Yes, I think I concur with George. I think awareness is critical, so that people understand, even when you pay for a certain health insurance, what is your entitlement? What is the benefits entitlement? Because a lot of people pay for it, but they don't know what they should be able to expect or ask for when they go to the service provider. So you pay, and NHIF says that this is a comprehensive cover, but when you get to the service provider, they tell you, no, that is not covered. So empowering the consumer to take charge and to understand what is it that they are paying for.
I want us to look at mechanisms that we can put in place for the private sector to make sure that there is public awareness when it comes to UHC. How can we set up mechanisms from the private sector? You can come to you, Bwana George.
Within the private sector, there is need for more collaboration within ourselves and also within the with the government in terms of reaching the community level. We have what we call community health workers who work in the grassroots level, and I believe by engaging them more, we will be able to reach and create awareness of the services that are being offered, and we will be heading somewhere in terms of UHC.
All right. Your take on these mechanisms that can be put in place to make UHC succeed from the private sector?
So I think first of all is to bring private sector into the fold, into the UHC fold, because right now we are brought in on a very ad hoc kind of basis. So just to have mechanisms that ensure that the private sector is part and parcel of driving the UHC agenda, and we spoke about just the pilot that was happening. private sector should have been on board to also see how this program would work in a private setting. Secondly, as we talk about access, increased access, I think we also need to talk about quality of care. And this is where also private sector comes in. So ensuring that our facilities are continuing to meet, first of all, the demands in terms of access, but also the quality of care that customers can come to rely on. So ensure that the quality assurance frameworks that have been put in place by the government are also being cascaded down to the private sector for us to have a uniform implementation of services within the country.
All right. I remember there was a time that the CS Sicily Karaoke said that, and I would like to quote, "We have learned that it is important to utilize a financing mechanism that delivers efficiency and also ensures the pooling of health risks and thus containment of health costs and reduction of inequality in access to health services." Now let's talk about this that she has mentioned, pooling of health risks. How can we involve the private sector in this with regards to UHC?
Okay, so pooling of resources, I believe we understand, is ensuring that we are not having fragmented schemes within our context as Kenyans.
Yes.
And let me give you an example. So the government of Kenya is rolling out free maternity services in one cohort of the population. Then there is Eduafia on one cohort. Then there are other subsidy schemes that run within the NHIF. If all these resources were pulled together, we could be able to ensure that someone is able to receive a comprehensive essential package from a public facility or from a government facility.
But so far everything is all
fragmented. It's fragmented. Yeah. So bringing all these initiatives we have into one pot and then seeing with the resources that we have. I think George stated it very well. You cannot be all things to all people. So start somewhere. So with the risk, with the pool of resources that you have pulled, what is the essential basic package that you can be able to offer to Kenyans for them to at least have some primary healthcare services, and then roll out that through the through the public and through the private facilities.
Could this be one of the reasons why we have fragmentation of different ideas about UHC, different ways of going through this of giving service delivery?
I think we need to borrow from the lessons that we learned from the UHC pilots. What was successful needs to be discussed further and implemented. The other thing that would cause fragmentation of what is being offered would be, we have different cohorts. Cohorts would mean different age groups, which have specifically different needs. Like today, we are talking about the youth being the people who are mostly affected by HIV/AIDS, isn't it? That's a risk. We also have children who are under 5. I think the WHO was complaining about measles, the death of measles, up to around 140,000, isn't it? Why are we having all this? All those risks need to be identified, but then we need also to prioritize on those risks, because we can't manage all of them. Prioritize one, fund them. If they are successful, sustain them, move on to another risk.
Okay.
That would be a better way of ensuring that when we start rolling UHC, it is sustainable in the long run, and it is having the greatest impact to where we have the greatest problems.
What are the challenges you've faced in working together to achieve your agenda, to achieve the roles that you've set for yourselves throughout this whole journey of more than 10 years, now 10 years that you've been working together? George?
We've had challenges with the Ministry of Health, and some of the challenges, that is the reason why we also partnered with Tunza, was in terms of access to trainings. It was not equitable. And we all want to offer quality services. So at times, just a few people are handpicked for training, and you're all left out. So in the long run, that person that you've left out is still serving Kenyans. So I think in terms of when it comes to training and strengthening of the facility, we need to cut across board, because the Kenyans are seeking services across board, and that's where we need to go.
So everyone did not get an equal chance to get the training?
Definitely.
Nepotism in a way?
Not really nepotism. I think it's insufficient funding or something.
Insufficient funding.
Yes, I think so.
All right. Challenges that you faced?
So I think first of all is trying to convince government and stakeholders such as NHIF that the private sector is fit for purpose and they can be able to offer reliable services to consumers. Yeah. So one of the things that we've done as PS Kenya is do a lot of advocacy to let NHIF know that care is being provided by small and middle-level health facilities at the community. How do you come in as NHIF to accredit them, to engage them, and empower them for them to be able to offer services to an ever-increasing pool of customers? Because NHIF has been out, they have been recruiting customers, but where are those customers terminating to? Not everyone can terminate into a public facility. So just telling them we have a channel that works, it's quality assured, how can you be able to plug in to ensure that your customers are receiving the services that they require?
As we bring this discussion to a close, what is the way forward for the private sector and key stakeholders with regards to achieving the UHC? You say it's achievable. You say it's possible. So many people may have a different opinion, but what would be your your word to the private sector as we finalize?
So I like being optimistic, and why I'm saying it's achievable is because we've made major milestones as a country. Yeah. We are certainly not where we were 5 years ago. So what I would want to see happening more is for everyone that is involved, all stakeholders in health, to realize that UHC cannot be achieved by government alone. It's a collaborative effort between both the private and the public sector. And the realization that Kenya is indeed a mixed health system, and you cannot be able to overlook the role that the private sector is playing in increasing access to care. Right. You said it, 50% of the population access services through the private sector. So you cannot ignore them as you talk about the UHC agenda.
They're still so important.
They are so important. We cannot overemphasize that enough.
In fact, some people just have, like, the private sector is their only way, the only source of getting medical services.
Exactly. And I think we also need to remove this preconception that private sector means big, large health facilities. No, it's your regular estate facility. All right. That is private sector.
Your final word, speak to the private sector. What would you say about the way forward for us?
To the private sector in health, I think time has come for us to be very bold in terms of engaging the government and the Ministry of Health in inclusivity, being included in major decisions that affect the health of this nation. And I want to say that we are so much willing to help the government achieve UHC. All right. So we are ready to partner with the government, and we have already partnered with NHIF, the super cover, the civil servant scheme, and it is working very well.
All right.
Yes.
Now let me just read a sample, feedback. SMS 20154 is the number. Start with the word Channel 1. Tell us your name, where you are watching us from, as you give us your take, questions, comments, as we have this discussion. On Twitter, the hashtag is Good Morning Kenya. Tag me at Ram Aguko, at KBC Television, at Jane Wamboy. Now, one person is saying, what are the best insurance companies recommended for UHC, especially for huge bills like 1 million? Maybe you can address that. Do you have such?
So I don't want to look like I'm advocating for a private
but NHIF is
but NHIF, I think NHIF still covers a lot of services, provides a lot of services, and so despite the issues around NHIF, I think we need not throw away the baby and the bathwater. We are asking, how can we be able to strengthen NHIF as a mechanism for us to deliver universal health coverage through it. It still covers. You spoke about 25% of the population being covered. I'll have you know that 80% of those covered are covered by NHIF. So it's still really the elephant in the room.
So NHIF is a big mama.
Yeah. I think NHIF, what people need to understand is that NHIF has different schemes. Different schemes means that if you seek to have an X-ray done, it can be supported by NHIF. If you need to have a MRI scan done, it needs to be, it can be supported by NHIF. But then there is that channel of care that you have to follow. You have to see that particular doctor who sees the need for a particular test or examination.
All right.
Yes.
We have someone saying, good morning. May you ask these people about dye? I don't know how to call it. Dye ya kupaka kwa nywele ati inaleta cancer, breast cancer. Please, thank you very much. I think we should have this discussion later on about cancer. We will address that. In fact, we also have some of our discussions on health. Yes, you can get also on health our interviews on health matters on YouTube. My director is asking me kwani he dye ukipaka unapata cancer, breast cancer. Well, it is a discussion that Kenyans need to be aware about it. Go to YouTube. The handle is on YouTube, KBC TV shows. Go to Good Morning Kenya. You can be able to get our interviews there with regards to cancer and much more. Health Tuesday is what we are all about. Sindio? Now, back to universal health coverage as we bring this discussion to a close. Tunza is taking stock of the journey. 10 years on.
10 years on.
Huh?
10 years on.
What do you have planned now? I remember you mentioned that earlier on. 10 years. What plans do you have to kimaliza kitu?
So we...
1 minute.
Yes. So we've walked this journey for the last 10 years. And the thing is that we have lessons that we have learned on how to effectively implement services through the private sector. So what we want to do tomorrow through an event is to share what our lessons have been, what our challenges has been, and what we have in the future for ourselves and for Kenya as we move on to the next decade.
All right. So so you're having an event tomorrow?
We're having an event tomorrow.
Where is it taking place? So
the event is going to be at Pan-Afric Hotel. It's an invite-only event, unfortunately. Okay. But we will see how, in next year, in 2020, we can be able to go out to the community and just celebrate and share some of the successes we have had as Tunza.
All right.
Yeah.
Thank you very much. My director nauliza hata hajaliko bwana. Well, invites only. But do we say? That is Rita Mwachandi, Senior Business Manager, Population Service Kenya, and George Muli Madheka, Director at Oloibon Medical Center, a private health care provider under Tunza. Right?
Yes.
Thank you very much, ladies and gentlemen, for joining me. It has been a pleasure having you.
Thank you for having us.
From home, additional information on Tuesday on Tunza can be found on the PS Kenya website.
Yes.
Yeah. At
www.pskenya.org.
All right. Naona mtu anakupigia simu hapo hivi. Unataka kutunza Kenya. Keep texting, keep tweeting. The hashtag is Good Morning Kenya. Tag me, Aguko at Jane Wamboi and at KBC Television. That is what brings us to the end of our segment today, the very first segment on health matters. We are taking a short break. We'll be back. Remember, after this break, at the end, we'll be having one very important guest, the Regional Commissioner. Stick around for that discussion after this short break. We'll be back in a bit. Keep it Good Morning Kenya. Keep it KBC.